Hi, everybody. I'm Dean Jane Georges of the Hahn School of Nursing at the University of San Diego. Welcome. This is going to be the first of what I hope will be weekly video chats with you for all our faculty, our students, and our staff. Today, we have a very wonderful guest. We have Dr. Michael Terry with us. Dr. Terry is a clinical professor at the Hahn School of Nursing, and he holds the Doctor of Nursing Practice degree from the University of San Francisco. Dr. Terry is nationally certified as a family and psychiatric nurse practitioner. So I thought we would have a conversation with Dr. Terry about the things that seem to be most concerned to most nurses I've talked to these days. We know this is a very, very unique situation. So, Dr. Terry, can you tell us what happens when somebody encounters a crisis situation? What happens?
Well, typically what happens is we get the fight or flight reaction. We get a surge essentially from our adrenal glands, and we give ourselves a shot, basically, which lasts about 10 minutes in the body, unless we kind of give ourselves another shot, which is what happens in a panic disorder. We keep giving ourselves shots. Sometimes because we become anxious or stressed about something, we kind of keep giving ourselves shots. So for example, if you were to stop at a stop sign and then a pedestrian crosses, you suddenly discover them and you slam on your brakes, that goes away in just a few minutes because you know that the danger is over. And that danger is a vital protection, for us. That's been there really for a long time since we essentially were surviving with dangerous places. And that part of the brain in the hippocampus and the amygdala that senses danger looks at something and it doesn't really see things as well. It's below our conscious level. So it sees things that remind it of something dangerous, or it sees things that the difference between seeing a headlight, for example, in the part of the brain and visualizing a headlight are exactly the same in terms of how the brain works. And both of these can be seen as, if they're interpreted as danger, particularly if they're unconscious, then that sends an impulse right away to protect ourselves, to fight or to flee. Now, what happens in that is if we sense that our body is anxious and we pick up on how tense we are and we feel our heart racing and breathing, or we start to shake or tremor, the kind of incident I mentioned in terms of the example of a pedestrian and stopping goes by. But if we don't know what it is, then we interpret that as more danger and we keep giving ourselves shots. So we keep stressing ourselves. Now, if that goes on for a long period of time, then we switch over to a cortisol injection, and we maintain cortisol, which actually depletes our cortisol system and keeps us under stress and leads to a pro-inflammatory kind of condition. So it's important in these times that we not continue to see ourselves as stressed, because we'll switch over from the fight or flight when we're really active and then to the cortisol damping system, protection system, and that really hurts our immune system, which we really need in these times.
For sure. I talked to some nurses who are on the front lines, and they have said to me, I feel like a soldier in this fight and I'm on the front lines. What advice would you give to someone who's in that degree of stressful situation?
Yeah, so there really is kind of three ways to look at a situation like this. There's this kind of anticipatory kind of worry about going into it that we have about, how bad will it be? And we can really amp that up, and some people will catastrophize. They'll take that to the nth degree. They'll apply Murphy's Law. What can go wrong will go wrong at the worst possible time. And they'll stick with that, which of course then inflames the fight or flight and then the cortisol system just through that worrying. So to handle the worry part of it, when you're not actually faced with the danger, we need to we need to pick up on the early clues, the cues in our body that tell us that our shoulders are rising up, our stomach's acting up. Anxiety tends to have three different levels that it shows ourselves. Level one is when it shows ourselves in the musculoskeletal system, and we feel it in our muscles, and we feel maybe headaches, and often headaches actually start in the shoulders and the neck and then rise up to the frontalis muscles, and you don't notice it till there's pain, but it started earlier and we could have picked it up sooner.
Okay.
And then the second way is when we have the smooth muscle system activated. So then we get stomach upset, and then we get nausea, then we get loose stools, then we get grumbling and bloating, and we get anorexia. And the third way is when we start to in our thinking and our defense system, we start to kind of dissociate. We start to kind of like giggle. We're overwhelmed with stress. We cry for very little reason. It's not a pseudobulbar affect, which is an actual disorder, but it's a result of stress. So those kind of things are anxiety in the body. So we want to pick it up before it kind of like gets to level 3 and notice it earlier. So that takes some practice. That can't just be done. And then there's the second thing. The second thing is when you basically are, faced with a dangerous situation, and you have this dread, and the dread is nothing you can do about. Essentially, you have to look at it and say, well, what is here about? It's very like the worry, but it's kind of like at another level. And then finally, there's this sense of vigilance and hypervigilance, which is really a proactive stance. Now, what goes wrong with that is it's just what happens with active duty service members who are on deployment. They stay in deployment for a long period of times and they stay activated, and they come back and they're hypervigilant because they've learned to be hypervigilant and to scan the environment for any danger and any clues. So even when they get back to a green zone or they return home, they've still learned that kind of situation, and it's very hard to let it down. So what we need to do is in that situation is scan for danger, but also recognize what are we doing that where is the danger? How much of it is essentially our fear, our dread? How much anxiety are we putting into it? And how much is there really a serious danger? Now, if there's danger, we take action. Mm-hmm. And the action means that we essentially avoid the contact. We use the protective gear, the PPE that we need to use. We anticipate, we maintain social distancing, all the things that we're taught to do as nurses, and particularly from our public health training that we know how to maintain when we go into face-to-face in a home or into a med-surg unit or ICU or ED. So I think when we take action and protect ourselves and avoid the contact, and then do that when we're coming home to our families, so that we limit bringing stuff home by either taking our clothes off and leaving them at the door, or by making sure we're washing, by making sure that we bring nothing home, and we maintain our immune system, which means keeping the cortisol down, which means getting at least 7-8 hours of sleep, because that impacts your immune system. What also happens is if your nutrition is poor and you're essentially maintaining high lipid levels, then you're also prone to pro-inflammatory kind of stress, which is the cortisol and immune system depletion. So regular exercise, which just means stress relief, which means kind of like limiting the time you spend at a computer, for example, or without taking a break. When you can get a chance to get outside and to walk, or even if you're just inside on any kind of equipment, just any kind of breathing and activation for anywhere like 20-30 minutes a day, or frequently during the day to let off the stress because you're picking it up. And then, of course, the sleep and the eating.
For sure. And now, our hearts and our prayers go out to the nurses in the front lines. But there are a fair number of people like me, over age 60, with coexisting conditions, and we now feel very isolated. Is it important for us to reach out to other people and maintain connections?
That's more important than ever.
Okay.
So there's a lot of new kind of very inventive things that are coming out. There's, for example, a psychiatrist friend of mine, her kids are at home. She's got a college kid, a graduate student, and one who is in high school. And they've started a thing called Kids for Kindness. And so they're doing delivery service. They're reaching out. You can go to their website and you can sign up on a form that says that you want to contact people who are shut-ins. You want to contact people who might be at nursing homes, for example, or people who are alone. And it's more important than ever now to kind of reach out to our friends. I don't just mean Facebook. I mean more live connection, whether it's Zoom or whether it's FaceTime, or whether it's even just sending videos to one another so that we have the sense of interaction. But reaching out, getting on the phone, making those phone calls. The isolation is very damaging, particularly for those of us who need it more, who essentially grew up in more of an era where we had more social contact, where this isolation is really novel to us. And as we age, that becomes more important than ever.
It's been amazing to me. I remember a term from psych back when I was in school of liminal resonance, meaning resonating with that person with whom you're communicating. And to me, there's no substitute for it. Feeling understood, feeling listened to. And I think that's something we're going to have to make a real effort to do via phone or via Zoom in the days that follow.
Yeah, it's no surprise, that we essentially evolved to tell story. As a human species, we learn from each other. We learn what's dangerous, what's not, how to solve things, how to anticipate. So storing is an essential part of our survival mechanism, and it's been there even before we had language.
Wow.
But a story takes a teller and a receiver.
Yeah. That is so wonderful. In my qualitative research classes, I always talk about the power of the narrative, and I never thought about it from that evolutionary perspective, but that is so very powerful.
Mm-hmm.
Well, we really appreciate your advice, appreciate your being there for us. And again, from all of the faculty at the Hahn School of Nursing to all of our alums, all of our students who are out there working on the front lines, we want you to know you are our heroes today. We are thinking of you, and we'll see you next time. Okay, bye-bye. Thanks, Dr. Terry.